21 CFR Part 111, Subpart L, Returned Dietary Supplements. Presented by Learn GMP Incorporated in collaboration with Technical Training and Consultation Service LLC. Content: Introduction. General requirements for handling returned dietary supplements. Records for returned dietary supplements. Disposition of returned dietary supplements. Handling of returned dietary supplements and distribution. Responsibilities under Subpart L. Importance of Subpart L. Introduction. Subpart L of 21 CFR Part 111 focuses on the handling, evaluation, and disposition of returned dietary supplements. The goal of this subpart is to ensure that returned dietary supplements are managed in a way that maintains the safety, quality, and integrity of the products. Proper procedures for handling returns are critical for preventing contamination or further degradation of the product and for ensuring that only safe, high-quality products reach consumers. General requirements for handling returned dietary supplements. Section 111.503. Proper handling of returns. Dietary supplements that are returned must be handled in a way that prevents contamination, adulteration, or degradation. The returned products must be quarantined until they are properly evaluated for safety, quality, and compliance with specifications. Evaluation of returns. The manufacturer must evaluate the condition of returned dietary supplements and determine whether they can be used again, reprocessed, or need to be discarded. General requirements for handling returned dietary supplements. Section 111.503. This evaluation must include a review of the reason for the return, for examples, defect, customer dissatisfaction, packaging issue, the condition of the product when returned, any potential risks related to the returned product, documentation. A record of each returned product must be maintained, documenting the reason for the return, the condition of the returned product, the disposition of the returned product, for examples, reprocessing, disposal. Records for returned dietary supplements. Section 111.510. Record maintenance. Detailed records must be kept for each returned dietary supplement, including the identity of the product, including lot or batch numbers, the reason for the return, for examples, product defect, damage during shipping, etc., any inspection or testing performed on the returned product, the action taken after evaluation, for examples, reconditioning, disposal, redistribution. Records for returned dietary supplements. Section 111.510. Retention of records. Records related to returns must be retained in accordance with the manufacturer's record retention policy. Typically, records must be kept for 1 year after the expiration date of the product or for 2 years if no expiration date is used. Disposal of returns. If the returned dietary supplements are deemed to be unsalvageable, they must be disposed of properly and documented in the return records. In some cases, if the product is unsafe or cannot be reconditioned, it should be destroyed to prevent it from entering the market. Disposition of returned dietary supplements. Section 111.515. Disposition determination. A qualified individual, such as a member of the quality control or quality assurance team, must determine the disposition of each returned dietary supplement based on its evaluation. Possible dispositions include reconditioning, if the product can be salvaged or reprocessed to meet specifications. Disposal, if the product is unsafe or cannot be used, it must be disposed of in a manner that ensures it does not re-enter the market. Repackaging, if the product is still within specification but requires repackaging, for examples, damaged packaging. Redistribution, if the product is returned unopened, in good condition, and within shelf life, it may be eligible for redistribution. Risk assessment. For each returned product, a risk assessment should be performed to determine whether there is any possibility of contamination, adulteration, or any other risk to consumer safety. If a risk is identified, the product should be disposed of or undergo reprocessing as necessary. Handling of returned dietary supplements and distribution. Section 111.520. Return and redistribute. If a product is returned and the decision is made to redistribute it, it must meet all specifications and be verified to ensure that it has not been altered, degraded, or contaminated during the return process. If the product is within its expiration date, it is still sealed, and no tampering or contamination is evident, the product may be eligible for redistribution. preventing adulteration or contamination. Manufacturers must ensure that returned dietary supplements are handled in a way that prevents the risk of contamination or adulteration, including proper quarantine and evaluation procedures, secure storage before disposition, proper labeling of return products that are put back into distribution. Responsibilities under Subpart L. Quarantine return products. All returned dietary supplements must be quarantined until their condition is evaluated and their disposition is determined. Evaluate the condition of return products. The manufacturer must carefully evaluate return products to ensure that they have not been contaminated, adulterated, or otherwise compromised during their return. Maintain accurate records. Detailed records must be kept for each return product, including its lot number, reason for return, and any actions taken. These records must be retained for the required retention period. Distribute safe products. Only return products that meet specifications and safety standards should be redistributed. Products that do not meet standards must be discarded or reprocessed as necessary. Implement reprocessing if necessary. If return products can be reconditioned or reprocessed to meet specifications, clear procedures for this process must be followed, and the results must be documented. Importance of Subpart L. Consumer safety. Proper handling and evaluation of returned dietary supplements help ensure that only safe, high-quality products are redistributed or reprocessed. Quality control. By keeping detailed records and maintaining control over the disposition of returns, manufacturers can ensure that dietary supplements remain consistent with quality and safety standards. Regulatory compliance. Adherence to Subpart L requirements ensures that the manufacturer complies with FDA's current Good Manufacturing Practices (CGMP) for dietary supplements and minimizes regulatory risk. Traceability and accountability. By maintaining detailed records of returns and their dispositions, manufacturers can trace the history of each product, which is critical for audits, inspections, or product recalls. Product integrity. Proper handling of returns protects the integrity of dietary supplements, preventing the redistribution of adulterated or unsafe products. Thanks for watching our channel. Feel free to reach us at contact@learngmp.com for any training and consultation requirements.